something useful about cranial nerves. I will use a technique what we call as mnemonics. Mnemonics are these are memory aids. These are memory aids. Now let us start with cranial nerves. Let us start with cranial nerves. So, which is the first cranial nerve?
Olfactory.
How many among you knew as of now olfactory is the first cranial nerve? How many among you knew it or had any confusion? सबको पता था अभी तक olfactory किसी को confusion था. चलो जब जिसको confusion था उसको कैसे दूर हो जाएगा? Olfaction is, what does olfaction mean?
Sense of smell.
Smell organ is nose. Nose is one or two.
One.
So nose is only
One.
so it is the
First.
first cranial nerve. It is the first cranial
No.
nerve. Then coming to second cranial nerve, which is the
Optic.
optic nerve. So how to remember? Very easy. Eyes are
Two.
two. Eyes are
Two.
so it is the
Second cranial.
second cranial nerve. It is the second cranial nerve. Eyes are two, so it is the second cranial nerve. Is it sensory or motor or mixed?
It is sensory.
It is sensory. And what about the first cranial nerve?
Sensory.
Sensory. Then coming to third cranial nerve,
Oculomotor.
oculomotor. Then oculo is associated with, again, oculo term is associated with,
Eyes.
eye. Oculo is associated with
Eye.
eye means 1, 2, 3. It is the
Third cranial nerve.
oculo is associated with eye. Eye is 1, 2, 3. So it is third cranial nerve. Now coming to the fourth cranial nerve, which is trochlea. Where does the name trochlea come from? Why we call it as trochlear nerve? Why we call it as trochlear nerve? Anybody? Trochlear nerve has its origin from the structure what we call as trochlea. Trochlea, as you know, is a pulley-like structure. Basically, this structure is present in the superior obliquus muscle. There is a pulley-like structure with which in which the tendon of that a cartilaginous pulley-like structure, a cartilaginous pulley-like structure, in which the tendon of trochlear muscle, not trochlear muscle, superior obliquus muscle passes. So the name trochlea is associated with the trochlea in which the tendon of superior obliquus muscle passes. Now because this trochlea is closely associated with superior obliquus, and because that nerve innervates superior obliquus, so that fourth cranial nerve is actually owning its name not because of itself but because of the trochlea. Got my point? How it is a trochlear nerve? Now, trochlea, which is a pulley-like structure, so when we talk of trochlear nerve, you should always have trochlea in your mind. Trochlea, 1, 2, 3, 4, 5, 6, 7, 8. Trochlea. Trochlea. How many words?
8.
So n by 2. 8 by 2 is
4. Fourth cranial.
Okay, so it is fourth cranial nerve, and it is a motor nerve. Okay, and this trochlear nerve passes through a foramen, what we call as foramen orbitorotangle. This OR stands for orbitorotangle. It passes through foramen orbitorotangle, right? Then coming to the fifth cranial nerve, trigeminal, right?
Yes.
Trigeminal. Trigeminal because it is basically formed of three branches, what we call as MOM, maxillary, ophthalmic, and mandibular. Now trigeminal, again it is a mixed cranial nerve. It is a
Mixed
when
cranial.
you count the words in trigeminal, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So n by
2. 5.
5. So it is n by 2, 5. Okay, n by 2 is 5.
Five.
So it is again fifth
Fifth
cranial nerve.
nerve.
Now, abduction nerve. Abduction nerve. The word abduction is basically associated with the term abduction. Abduction means movement away from the body or median line. Because our eye, the moment that we do like this is abduction, and it is abduction. So for abduction, you always remember the term function abduct. Okay? Abduct. Okay? Abduct. So these are the things. It doesn't matter that, it doesn't mean that we should rely on these formulae, but they will support us maybe at the right time. They will support us at the right. Now I will further elaborate this term abduct, as this is the lateral movement. Naturally, medial movement will bring towards the midline of the body. Lateral movement will bring towards the
Outside.
will rather get it away. So abduct, that means it is lateral movement, isn't it? Abduct is.
Lateral.
So now automatically tell me which will be the muscle that will be causing this function. There are recti muscles in our eye. So what muscle will be that?
Lateral rectus.
Lateral.
Rectus.
So it will be lateral rectus. Now you got my point. So abduction, lateral rectus, abduction nerve. Abduction, lateral rectus, right? As we understand, abduction is nothing but is lateral movement which will be caused by lateral rectus muscle, and again, automatically abduction, we should correlate abduction with abduction nerve. So that means abduction nerve will be innervating lateral rectus, and it is sixth cranial nerve. You will simply remember abduct. Okay? Abduct. Then, which one?
Fascia.
Fascia. Fascia. It will innervate facial muscles. So, 1, 2, 3, 4, 5, 6, n plus 1. 7. When you practice it, it becomes slightly interesting. And it is a lifelong memory. Then it will not forget. Okay? So, n plus 1 will make it 7. N plus 1 is such concept, we call it as concept of numeracy. What is it is termed as?
Concept of numerous.
As a memory aid. Okay, you can do this for many other things. Okay, then facial. After facial we have
Vestibulocochlear.
vestibulocochlear. में से एक इस वाले को देखो, cochlear. 1, 2, 3, 4, 5, 6, 7, 8. So vestibulocochlear. Cochlear is, it is 8th cranial nerve. 8th cranial nerve. Okay, it is 8th cranial nerve. Then it is a sensory nerve, isn't it? It is a sensory nerve. Then we come with 9th.
Pharyngeal.
Pharyngeal. इसमें कितना है? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, इसमें कुछ ठीक है? Glossopharyngeal उसको देख लेना. So this is glossopharyngeal is 9th. ठीक है? Pharyngeal में ट्राई करते हैं. Pharyngeal में कितने आएंगे? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, n minus 1. ठीक है ना? Pharyngeal, n minus 1. And you will just practice. I know some of you may already know this, but sometimes what I have checked when I asked most of the students, they made it wrong. They did not do it exactly. So that is why when you do 1, 2 times, it brings some interest in your studies. It is not, they are just a support to bring more attention. If something brings more attention in you, there is nothing wrong, isn't it? So glossopharyngeal, again, it is a mixed cranial nerve, and it is 9th. Then vagus. And 2n. 2n. 1, 2, 3, 4, 5. 2 into 5. is 10. Then there is another important information in this term vagus itself. V means vagus, right? A means accessory spinal, 11th cranial nerve. Accessory
Spinal.
spinal. Meanwhile, let us check accessory spinal. 1, 2, 3, 4, 5, 6, 7, 8, 9. Spinal. 10, 11, 12, 13, 14, 15. 16, 17, 18, 19, 20. It is 11th. Okay, it's very good. So it is 11th. Vagus, V means vagus. That term vagus is A means
Accessory.
G means glossopharyngeal. So by using the word vagus, you can replicate it. V is vagus, A is accessory spine, G is glossopharyngeal. Now what is more specific with this? All these three nerves enter via a common foramen, what is called a
Jugular foramen.
Isn't it important? Vagus, accessory glossopharyngeal. Rather, all these three cranial nerves leave which foramen? Jugular foramen. They leave the cranial cavity via this jugular foramen. Okay, so you can remember now. It is not simple. It rather gives three informations now. Okay, then we have the last accessory. Again, it is motor accessory. Vagus is mixed, accessory is motor, and then we have the last one, which is that
Hypoglossal.
hypoglossal. Hypoglossal is 12th. Here you will use M plus 1. It has only, when you write hypoglossal, there will be 11 letters. You can check. Hypoglossal has. So here you will use M plus 1. It is the 12th cranial nerve. Now, even the term cranial nerve, count the number of words in the cranial nerve. Even the term cranial nerve says I am 12. Okay. So cranial nerves are 12, you know that. Now, it is not that I am using these formulae blindly. They are based on certain concepts. Like I will use now another concept. There is a sentence I use this more often. Vagus goes for mixed tour. What does it mean? Basically, it is a scientific statement. Vagus is a wrangler nerve, wanderer nerve. It almost covers the entire body, except starting from head region, it will reach neck. So now the organs that it supplies, let me tell you. It supplies part of tongue, it supplies pharynx, it supplies larynx. It is the pores. It supplies the organs of pneumogastric system, which is respiratory system and digestive system, and it reaches pelvis, where it contributes to the parasympathetic nervous system. So it is a wanderer nervous system. So the sentence vagus goes for mixed tour. What does it mean? It almost travels entire. So that's why I am using the term vagus goes for
Mixed tour.
V is vagus. V is
Vagus.
G is glossopharyngeal.
Is
M is mixed. So vagus goes. F is fascial. F is T is trigeminal. So vagus, glossopharyngeal, fascial, trigeminal. They are mixed in nature, right? Vagus,
Glossopharyngeal.
trigeminal, they are mixed in nature. Okay. Now another thing. Let us see the term motor. How many alphabets are in the term motor?
5.
Exactly the number of motor cranial nerves. In motor there are 5 alphabets. Exactly the number of
Motor.
So how many motor cranial nerves do we have?
5.
5. We have 5 motor cranial nerves. How many mixed cranial nerves we have?
4.
4. We have 4 mixed cranial nerves. Then we remain with
3.
So now another interesting thing. So if you do like this, motor N, number of alphabets is
5.
N minus 1 is equal to, they are mixed. Okay? N minus 2 is equal to, they are sensory. So total 12. 5, 4, 3. Okay, there. So n 5, n minus 1 4, n minus 2 3. So there is a rhythm in this. There is a symmetry. Okay. This was about cranial nerves. थोड़ा सा कुछ फायदा आया कि नहीं?
Yes, sir.
और क्या और किसमें एग्जाम है? आई में तो अच्छा आई के नर्व्स में उसमें तो हमने ये बताया ना आपको फार्मूला लैटरल रेक्टस के लिए अब आपको भूलना नहीं चाहिए एबडक्ट lateral movement is abduction, so you should never forget lateral rectus abduction nerve. What is this? There is a muscle, we call it as dorsal obliquus, the other superior obliquus, what we were talking of, the trochlea. It is that trochlea which is associated with dorsal obliquus muscle. Dorsal obliquus is supplied by trochlear nerve dot. Or you can, because it is other name is superior obliquus, so you write sorting. Superior obliquus is supplied by trochlear nerve. ठीक है ना? Superior obliquus is supplied by trochlear nerve. अब numbering तो पता है याद कैसे रखना है? Abduct means 6, trochlea is pulley n/2. It is not 8, it is 4. अच्छा, oculomotor का हमने आपको बताया वो थर्ड है. Oculo means eye. उसका एक और चीज और याद रखिए. OR means it passes through orbitorotendon. Oculomotor, OR. It comes out where? Foramen orbitorotendon. हो गया oculomotor. Okay? Oculomotor. Then किस फोरामेन से जाओगे डॉट हो गया. लेटरल रेक्टस याद रह गया आपको. बताओ आई मसल्स में और कौन सी नर्व इनर्वेट करती है? oculomotor supplies majority of the muscles. Most of the muscles are innervated by
Oculomotor.
one muscle, lateral rectus, is innervated by
Abducens.
dorsal obliquus is innervated by
Trochlear.
मुझे लगता है 3 ही नर्व्स इसके साथ जुड़े.
Retractor ocular.
Retractor को बात सुनो. Retractor is mainly supplied by oculomotor. Only the lateral part of the retractors is supplied by this abducens. So, but बहुत सारी बुक्स ये चीज डिस्कस नहीं करती कि lateral part. ठीक है ना? I don't want to go into the details because it has already been taught. I just wanted to give you some benefit because you have attended this class. So why should at least we? अब मैं ये I would have straight away gone into embryology, but I don't like few students will be here and I will teach you that concept. Then how is it possible that they will recover? Isn't it? I always feel about students in general. So this is it. Now what about the sensation of the eye? Sensation means sensory nerve of eye. Huh? Optic. Optic is basically for vision. So this is sense of vision. What about the sense of pain? You got my point? Vision की बात आ गई. Vision is itself a sense. But then there is a sense of touch, pain. What about that? For that we have ophthalmic nerve. That means the inside of the eye जो है ना, उसके अंदर जो नर्व जाती है ना, वो है कौन सी? Ophthalmic. एक हो गया eyelids को, उसको भी ophthalmic. Eyelids and these, even this area ophthalmic, this area. But then there comes within the eye the pain that is felt in the cornea. The pain that is felt in cornea, or maybe somebody will feel pain within eye. So where will that pain come from? That will come from ophthalmic nerve, and for that matter, ophthalmic nerve is itself a multi-branched nerve. It is a
Multi-branch.
So not all branches will be supplied. Not all branches will be supplied. Why? Because some are going to eyelid, some are going to glands, lacrimal gland, some are going to frontal sinus. Okay? So for that matter, we call that is long ciliary nerve. Remember, what is that nerve? Long ciliary. Ophthalmic branch का कौन सा? Long ciliary nerve. But then there is another aspect of the innervation of the eyeball. That is the accommodation of the eye. The light accommodation. What? Light accommodation. So that dilation and constriction of the pupil. Now that function is controlled by ciliary muscle. That function is controlled by ciliary muscle. That function is controlled by ciliary muscle. Now, for the ciliary muscle, because it is a smooth muscle, it will be governed by which part of the nervous system? Autonomic nervous system. It will be governed by autonomic nervous system. Governs those activities which are not under our voluntary will. Although they are regulated by nervous system, but they are not under our voluntary control. They are involuntary in nature. They will automatically constrict or dilate depending upon the amount of light we are exposed to. So for that matter, ciliary muscles, which of the cranial nerves does contribute to this function? Oculomotor, very nice. Via? How does it now contribute? You should remember the parasympathetic nervous system here is very important component. One is the nerve that will, suppose cranial nerve, this is suppose cranial nerve. Now the cranial nerve, there will be a ganglion, paravertebral ganglion in the spinal cord, but in the cranial part of the autonomic nervous system, means in the head region, here the ganglion is termed as autonomic ganglion. So this is the autonomic ganglion. For that, we call that as ciliary ganglion. We call that as ciliary ganglion. That ciliary ganglion is basically contributing to the autonomic nervous system. Okay, so it is via ciliary ganglion the autonomic part of the oculomotor will contribute. Right? This is slightly, it will need a separate deliberation. I'm not going to detail how the autonomic nervous system functions. अलग चीज हो जाएगा, फिर वो डिटेल में पढ़ना पड़ेगा. बट इतना आप याद रखिए, इसके साथ जो गैंग्लियन